I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo Gyno. Today I got a 19-year-old from Georgia. He's 6'1", 170 pounds, fit, really, a great body, but he's got these puffy nipples right there, nothing much. As a matter of fact, he was off and on and wanting to do it, not wanting to do it, and he's had it since puberty, and they're just not going away, and it bothers him. Now, let me do a little interesting thing here. He's a little relaxed. I took off his shirt, and I explained to him just what we're going to do. But this one's a little contracted and nice. This is going to change and relax a little bit, but this one's relaxed a little bit. See this one here? Now, when I lift it up, you can see that gland there. But watch what I do when I give it a flick, okay? Pinch it, give it a flick. And a lot of guys say before they go to a beach or whatever, they kind of flick their nip and it tightens up. See how it's starting to become like chicken skin and tightening up right there? So that is pretty normal. And a lot of people say if my nipples stay hard, I wouldn't do the operation. But see how that's tightened up, because nipples have muscle, and when you flick it or touch it or bang it or whatever, it tightens up. And when he's relaxed, on the beach, just had a beer, just relaxing, they'll just kind of relax and become more prominent. This one too. Lift up this. See, you got the gland there. If you give it a flick or squeeze it or whatever, watch this for a second now. That's going to also tighten up. See, you're starting to get that chicken skin there, right there. See that? And that's what happens. That's normal. That you have just gland gynecomastia, no fat. He's got no fat, needs no liposuction. Just get these puff titties out of there. Little scar, we were talking about that little seam. I call it a seam. Really very small, from about 4 o'clock to 8 o'clock, just enough to get the gland out. And we have to get the whole gland out, because I never want him to come back a year from now and say, oh, it's back and this and that. I don't want that. He could have some scar tissue, can form, and we'll teach him how to prevent that and treat it if that happens. No drains, local anesthesia. We will biopsy these glands just to make sure. That's about it. Let's go. Median. And this is the glands. I think the right side is a tad bigger. Yeah. I think. This is back muscle going this way, back muscle going that way. Not big back muscle at all. And look at the skin. You can see the serratus muscle very well. You can see a little bit of the six-pack abdomen. All right, Dr. Lebo, gyno, 19-year-old from Georgia. We did bilateral gynecomastia gland removal. He weighs 170, 6'1", athletic, and just had these glands a couple years, about 4 years now, and they just bothered him, especially now that he's active and going to the beach and all that stuff. He didn't like, having to pound his chest to make those nipples tighten up a little bit. So under local anesthesia, stealth incisions where the water meets the beach, we took out these glands to perfection. These are the glands. This was the right side, a little bit bigger than the left side. But it's important to note, look at the beauty of these glands, how they were removed just perfectly, not in pieces, not all beat up. Specifically on this right side, which was bigger, this was where the nipple laid, right there. This is the muscle side, nice and clean and pristine. The gland is the white, the little bit of fat is the yellow, and this is out totally and completely, and that's where the nipple lied right there. Same thing on this side. That's the muscle side right there. This one's a little bit smaller, and the nipple laid right in there. The left side was a little tougher, actually, a little more stuck than the right side, but both out to perfection, never a recurrence, and he'll just build muscle, eat healthy, and live the dream. So if you have gynecomastia, you want me, you need me, you gotta have me, from Georgia or from Guatemala or from Guadalupe, you call me Dr. Lebo Gyno, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.